We're here again to talk about a certain common condition which normally tend to affect the elderly people, but it can be found in all age groups. So today I want us to do a review on a condition called stroke. So as usual, we'll begin with the definition, go to the types, management, and all those stuff, how stroke presents. Yeah, so that's how it's going to be. So quickly, let's go to our definition. So what is stroke? If you're being asked what is stroke, so stroke, we can refer to it as a sudden neurological deficit caused by interruption of blood flow or blood supply to the brain. That one is referred to as ischemia or bleeding into the brain tissue, also known as hemorrhage. And this one can cause neuronal death, which begins between 3 to 5 minutes, making a medical emergency. Yeah, so as you have heard, stroke is a medical emergency. So as soon as you realize that somebody is suffering from stroke or might be having the symptoms of stroke, the action should be much way quicker. Yeah, so having said that, let's go to the types of stroke. Let's see how many types do we have. So the first type of stroke we have is called ischemic stroke, and this one normally it affects around 70 to 85% of the people who suffers from stroke. So what is ischemic stroke? So this one occurs due to occlusion or cerebral artery, occlusion of cerebral artery, and the occlusion can be caused by thrombus, which is a local clot, or sometimes embolus from heart or carotids. Now this will lead to reduced oxygen supply to the brain cells and eventually causing neurological deficits. The second type of stroke, we have hemorrhagic stroke. So from the name you can guess what it is. So hemorrhagic stroke, from the word bleeding. So this one occurs due to rupture of blood vessels causing bleeding. So when somebody bleeds, there will be rupture. When there's rupture, there will be bleeding. Then this eventually causing stroke due to blockage of the blood vessels supplying the brain with the oxygen and nutrients. Then so that one will also it will also result to increased intracranial pressure, because we know there's in the brain we have the cerebrospinal fluid, which normally circulates there, acting as a shock absorber, also moisturizing the brain. But now if you add another fluid or blood clots into the brain, this one will automatically cause the increased intracranial pressure. The third type of stroke we have is transient ischemic attack, also known as TIA. So this one is just a temporary ischemia with symptoms resolving within 24 hours. So this one is not as serious as it sounds, but it's just a temporary type of stroke, and it resolves within 24 hours if the interventions are taken as soon as possible. Having talked about the definition, the types of stroke, now let's move to the risk factors. And a risk factor is something that puts you in a position or something that predisposes you to getting a certain condition. So now the risk factors of stroke are divided into two classes. The first class, we have modifiable factors, and the second one, we have non-modifiable factors. Modifiable factors are factors that if we do something about them or if we intervene along the way, then our chances of getting stroke is reduced. But the non-modifiable ones, there's nothing we can do. Eventually stroke will catch up with us. So on the modifiable factors, we have hypertension, and we know that hypertension is the number one risk factor that predisposes us to getting stroke, because through hypertension, when you have high blood pressure, you are at risk of your small blood vessels bursting due to high blood pressure, and that one will result into a type of stroke which we have discussed earlier called hemorrhagic stroke. So that one is our number one risk factor. The second one, we have diabetes mellitus. We also have smoking. We have obesity, hyperlipidemia, which refers to high lipids in the body. We also have alcohol abuse and atrial fibrillation. So what atrial fibrillation is just a common irregular, often rapid heart rhythm caused by chaotic electrical signals in the heart's upper chambers, that is the atria, leading to inefficient pumping and higher stroke risk due to potential blood clots. And some of the symptoms of atrial fibrillation are dizziness, palpitations, and fatigue. Also, shortness of breath. So, yeah, those are the modifiable factors. On the non-modifiable factors, we have age, and they are non-modifiable because the moment you are aging, you cannot reduce your age to stop being at risk of getting stroke. So that's why these are referred to as non-modifiable factors. So the first one is age. Family history. When you're coming from a family where people are used to getting stroke, like it's in the family lineage, then there's nothing you can do about it because it's genetic. Then also, if there's a previous history of stroke, like earlier you had already experienced stroke, then you are also at risk of getting stroke. Now, on the clinical features, there's an acronym FAST, F-A-S-T. So it's a fast assessment. So F stands for first dropping, then A stands for arm weakness, then S, speech slurred, and time critical. So first dropping, those people with the stroke, you'll find that one side of their face, normally it's one side, normally it affects one side. So you'll find that one side tends to be dropping. Then on the arm, the affected side, you'll find that the arm becomes weakness. Maybe if you're carrying a cup or a cup of tea or any glass or anything in your hand, then there will be a sudden drop of whatever you are carrying in your hand. Then also slurred speech. Somebody was talking, then suddenly they are unable to communicate properly. Then also time critical. Other symptoms now, we have things like sudden unilateral weakness or numbness, then sudden confusion, you're just confused all of a sudden. Then we have visual disturbances, severe headache, loss of consciousness, and dysphagia. Let's move to the nursing management. So we'll start with the nursing management, then go to medical management. So on the nursing management, the immediate care is ABC. ABC is airway, breathing, and circulation. So we'll maintain the airway. We'll administer oxygen if SpO2 is less than 94%. We also monitor for vital signs because being that the patient is bleeding, they can go into hypotension. So we have to monitor vital signs. Then check for random blood sugar because also the patient might be going into hypo. So you have to check random blood sugar, and you also establish IV access. You do the cannulation. You keep the patient nil per oral to prevent the risk of aspiration. This one can also lead to pneumonia. So you keep them nil per oral until they stabilize. Then elevate the head of the bed to 30 degrees. This one also will prevent the risk of aspiration, so they don't lie flat. You elevate the head of the bed to around 30 degrees so that they can be in a comfortable position. Then also you do a continuous neurological assessment, that is GCS, to study the pupil response. Then on the medical management, now that we have the two major types of stroke, that is the ischemic and the hemorrhagic, they present the same, but the management is slightly different. So we will start with the ischemic stroke and the medications. We have the first one, you have thrombolytics, which is also known as clot busters. And under clot busters, we have alteplase, also known as TPA, and this medication is given between 4 to 5 hours of symptom onset. So it will dissolve the clot and requires a strict eligibility criteria. Also, you have to monitor for bleeding because if you overdose, then the patient will be at risk of bleeding. The second medication, we have antiplatelet drugs, and under antiplatelet drugs we have aspirin. That was the first medication, and also we have clopidogrel gel, and this medication, they prevent further clot formation, and they should be started after CT scan confirms there is no bleeding. So when you start the antiplatelet drugs. The third drug, we have anticoagulants only if indicated, and under anticoagulants we have heparin and warfarin. DOCs, e.g. apixaban, they used especially in atrial fibrillation. The fourth medication, we have statins, whereas we have atorvastatin, which this medication reduces cholesterol and future stroke risk, because we find that when there is a buildup of cholesterol within the arteries, then when there is a buildup of cholesterol within the arteries, then the diameter of the artery will reduce with time. This one results into two conditions called atherosclerosis and atherosclerosis, and also this leads to high blood pressure, which puts an individual at a risk of getting stroke. So that's why that medication is specifically given. So that was under ischemic stroke. Now under the hemorrhagic stroke medications, and I want you to note the differences. We have we manage hypertension and the increased intracranial pressure. So we will only give the medications to manage the hypertensive part of it and the increased intracranial pressure. Remember, there was bleeding, and so there will be increased volume of the fluid, that is the clot plus the cerebrospinal fluid in the brain, causing increased intracranial pressure. So we'll give an antihypertensive. The first one is labetalol or nicardipine to control and reduce bleeding and high blood pressure, because high blood pressure is the number one risk that puts you at getting stroke. So that's why we have to control blood pressure. Then the second one, we have the osmotic diuretics. You give diuretics, but osmotic diuretics. And under that one, we have mannitol. This one reduces intracranial pressure. Also, we give anticonvulsants. Remember, blood clots in the brain and increased intracranial pressure can result into convulsions, and seizures. So we have to give anticonvulsants, e.g. phenytoin, and to prevent seizures. And mark that in hemorrhagic stroke, there is no aspirin or anticoagulants in acute hemorrhagic, because the moment you give aspirin, these are blood thinners. So if you give aspirin, the person might excessively bleed, which can result into shock, then leading to death. So that's why you don't give aspirin in acute hemorrhagic stroke. Now that you've familiarized with the stroke, the definition, how it presents, the symptoms, the management, medical and nursing management. Now let's look on the complications of stroke, rehabilitation, and how we can prevent it from occurring. So the first complication, and the major one, is paralysis. Stroke is a unilateral condition, and it affects one side. So you find that the arm on the side that has been affected, functioning will be difficult. So that's why that is the number one complication of stroke. The second one, as I stated earlier, we have aspiration pneumonia. Aspiration pneumonia. Then you can also have pressure ulcers, maybe when you overstay. Now this one, and the long-term complication, when you overstay on the hospital, maybe sleeping on one side, there is no 2-hour turning as recommended by the nursing council, then you might be predisposed to getting pressure ulcers. Then also you can have urinary tract infections. You can be depressed, because remember, you are somebody who was functioning, you are doing the ADLs on your own, and now you'll be moving into a situation where you'll be needing help, or maybe of your wife or the relatives from time to time. So you'll be depressed. Also there will be cognitive impairment. Remember, stroke is affecting brain. The moment the brain cells lacks oxygen and nutrient supply, the cognitive impairment will be messed up with. And also the final one, remember I stated earlier that stroke these are the blood clots in the brain. And also in the brain we have what is called cerebrospinal fluid. This one functions by preventing the brain from any shock, external shock, and also it moisturizes the brain and feeds it. So it's the fluid that is normally found in the brain. So once another fluid adds in, or any material like blood clot or fluid, which is normally not there, so there will be increased intracranial pressure, because this is something which is unusual. Yeah, so those are the complications of a stroke. And so the things that we can do to help with the stroke patient, the rehabilitation. Now you can do physiotherapy, you can also do speech therapy. Remember, one of the presentations of stroke we talked about the slurred speech, so you have to do the speech therapy now that you to come back to normal slowly, gradually. Also you can do the occupational therapy, nutritional support. You have to be supported nutrition, so that you don't be in a state that you are malnourished. And the psychological support also, counseling, very important of all of them. Remember, the depression will now set in, so you have to look for a psychologist to counsel this patient, so that the state he or to the normal one. Then now, under the prevention, things that we can do to stop us from being at risk of getting stroke, the number one and the first one is strict BP control. If you're coming from a family history where there is high blood pressure, you should be monitoring your blood pressure from time to time, so that this one doesn't put you at risk of getting stroke. Then if you're a diabetic patient and also you have been diagnosed with high blood pressure, you need to manage the diabetes part of it properly, so that it doesn't put you at risk of getting stroke. Also, smoking cessation. If you're a high smoker, you need to reduce or quit, but you can reduce the amount of the cigarettes that you are smoking on a daily basis. If you are used to smoking 20, now you can be smoking 5 or 2 eventually, until you reach a point where you can quit now. Then regular exercise. Exercise is very important, my friends. You need to do regular exercise, and this one will help in the prevention of stroke. Also, we have the medication adherence. When you have been diagnosed with stroke now and you are on medication, so you have to adhere to your medications, so that the prognosis can be well. Yeah, so that's all about stroke. I guess we've covered everything, and if there is something that we've left out, you can let us know in the comment section, so that next time we can capture more things on our next discussion or lesson. Stay tuned, and we'll be coming with another lesson very soon. Goodbye.